In the previous video, we discussed a bit about what are the types of CML and what is the treatment of the first phase or the chronic phase of CML. So today we'll discuss about the next two stages, that is the stage where you have an accelerated phase or stage 2 of CML, and the third phase, that is CML blast crisis. So in the accelerated phase, you have the blast percentage in the blood or in the bone marrow between 11 to 20%. Now in this phase, you have already progressed from the first phase into this, or maybe have diagnosed directly into the accelerated phase where you might have been having the disease in your body for the last 3 to 5 years, which is slowly progressing and you are completely asymptomatic. So it is not something that you have missed the bus or you were not diagnosed early. Some of the patients can present de novo in the accelerated phase itself, which would be around 10 to 20% of the CMLs. So the treatment of this phase would be like the chronic phase itself, but you would be either on a high dose of imatinib or nilotinib or dasatinib, and we will do the mutation analysis at baseline to see whether the patient can tolerate or the disease is intrinsically resistant to either of these drugs. So you choose the drug as to what suits better for your disease. In the first phase, we choose as per the comorbidities, and here we have an additional factor. If the cancer is already resistant, then there is no point putting you on a drug which is not going to affect or not going to control your cancer. So that is why we have to be smart from the day one itself, do a mutation analysis, see what acts better on your cancer, and then treat you with that and monitor you if your cancer is responsive. Now, as in the first phase, you have to be adherent to the therapy and report to the medical oncologist a bit more frequently, maybe monthly visits, and keep monitoring whether you are progressing to the third stage or the blast phase. So monitoring would be a bit more closer, and any chance when your disease is not responding to the current modalities of treatment, or you sometimes have a pan-drug resistant mutations like T315I, where now you have a few ponatinib or few newer drugs which have come up which can be treated, but stem cell transplant, as we need in the blast crisis phase, would be the ultimate curative treatment. Now coming to the next blast phase. Now blast phase actually means you have progressed to an acute or fast growing blood cancer. Now CML, as the term was chronic myeloid leukemia, which was a slow growing process, has now turned up into a fast growing process. So we have to act quick. So the usual modalities of treatment would be similar on the terms, the way we treat acute leukemias like ALL or AML, along with the addition of the TKI, be it imatinib, dasatinib or nilotinib or the newer agents, with the dose which is according to the guidelines for the third phase. Bring the disease under control, and then if there is any sibling match, go to the match sibling donor, or if you don't have a match, be it by a half match transplant or an unrelated donor transplant, because bone marrow transplant is the only curative modality for blast crisis. Thank you.